Hi everybody, my name is Amy. I was an ICU nurse for 15 years. I did open heart and trauma, and I've taken care of many patients with ARDS, pneumonia, etc. So this COVID thing is a new bug, yes, but it behaves on the body at the severe cases like regular ARDS. So I thought I'd give you a little PSA on some preventative stuff that you can do to hopefully not get to that stage. First of all, if anybody's ever had surgery, this is an incentive spirometer. I'm sure you've seen one like this before or something similar. I'm going to show you how to properly use it. If you have one, get it out, dust it off. Don't share it, keep it to yourself. But this is how you properly use an IS, or incentive spirometer. What you want is this blue little guy right here to come up and hover in between these two blue lines. We don't want it shooting up top. We want it to inhale slowly. And you're going to make sure that this stays constant. Don't worry about how high this goes. This is simply measuring your amount of lung capacity. Your first breath is probably going to be your weakest, but that's okay. The job and the idea here is to improve over time. So here we go. I'm going to show you how to do a proper incentive spirometry breath. First thing we're going to do is put it between our teeth, like that. Wrap your lips around it and breathe in. Just like that. You're going to want to do that 10 times an hour. Sounds like a lot, kind of sounds intimidating, but what I usually tell my patients is if you're watching TV, you're going to do one breath for each commercial that you see. So you see a commercial for toothpaste, one breath. Commercial for a car, one breath. Then during your regular show, you put it down and you wait. When the commercials comes on again, do it again. You'll get your 10 breaths in, I guarantee you, in an hour. If you get tired out, pause, wait. Don't do them all in a row because you'll wind up getting lightheaded, and that defeats the whole purpose. The whole point of this is to open those lower airways. We don't use our whole lung when we breathe, generally speaking. Those lower areas are just kind of resting. So the job of this is to help those open and keep them open so that fluid can't collect in those spots. Now, I recommend if you don't have an IS, another way you can do this is when you start feeling ill, usually it starts with aches and things like that and a dry cough. Get up, okay? Sit up in a chair just like I am, feet on the floor if you can, and breathe. Take some slow, deep breaths. We're gonna breathe in for a count of 5 and out for a count of 7, okay? We're gonna breathe in through our nose like this. That's it. At the end, you're going to want to do those again, one for each commercial, because if you breathe like that all the time, you will get lightheaded. At the end of your session of breaths, I want you to give a good cough, just once, from the diaphragm like this. What that does is it creates positive pressure to those airways that we've opened. They have anything hanging out in them, you've just now forced that up to get out of there, that your body can then expel with coughing, etc. Hopefully that helps. Just little simple PSA from your friendly neighborhood nurse. Hope you're all doing well. Keep up the hand washing, keep up the social distancing. Stay well.